Hi, Dr. Carly here from Wave of Life Chiropractic, board certified chiropractor. Today we're going to be reviewing a case study of a pediatric patient who had chronic infections. She was getting ear infections, sinus infections. She was sick all the time. Let's review. First, what we're going to pull up is her original scan. So here, what you can see is how she had a ton of inflammation in the top part of her neck. Now, if you caught our live last week, remember that these scans are measuring the heat. They use conductive heat measurements coming off of the spine. This is telling us how the nerves surrounding the spine are being affected by that imbalance in the way that the spine is in the right position. So when we have those subluxations, it's affecting the vasodilation, it's being affected by the nerve constriction of that tissue surrounding the nerve, the muscles, the fascia, swelling, so edema surrounding the nerve. All of that creates a lot of inflammation and heat. So when the thermal scan is reading heat off of the spine, it's going to give us an idea of how well those nerves are functioning. So in her scan, you can see the top part of her neck has significant heat and inflammation on the left and the right side. Red is severe measurements, blue is moderate, which you can see in the lower back here. That's going to the digestive system. This right-hand side, my right-hand side, it might be yours, but your left, but the right-hand side of this chart is showing us the digestive organs that are being affected, the kidney, the liver, the stomach, and we have moderate inflammation down on the right-hand side of the low back. And then in the middle of the back, we see a green bar, which is measuring mild inflammation. So again, this young child was on the cycle of every 2 weeks getting the sniffles, it flaring up into double ear infections, flaring up into fevers, and she just couldn't get the hang of it. They would have like a week of her feeling better, not having any symptoms, and then all of a sudden she would get the sniffles again, and it would get blown into a full-blown fever, a full-blown ear infection, all of these things. And obviously the parents were exhausted. And we've seen so many kiddos like this who come in and they have so much inflammation in their nervous system. Their nervous system isn't able to balance, and that directly impacts your immune system. Your nervous system, your immune system, your digestive system, they're all working together to make sure that everything can move and work as smoothly as possible. And so if one is imbalanced, they're all imbalanced. And we are right away saw the inflammation at the top part of her neck here. And we were like, this is exactly what's going on. It makes complete sense that you're having these issues. So she has been getting adjusted for the past month. She's been coming 3 times a week. Frequency is everything. Now, when you go to the medical doctor, you're going to get 10 days of antibiotics. You can't take it one every 10 weeks, once a week. You are taking it every single day for 10 weeks because it builds upon itself. It helps make sure that they're killing off the bacteria, and that's how the antibiotics can work in an efficient way. Adjustments, everything that you do that's healthy, it builds upon itself. So adjustments need to be frequent and consistent in order to create muscle memory to ensure that you are seeing changes in the way that the muscles are holding the bones in the proper position. So she has been getting adjusted 3 times a week for the last month. Now, if you are on TikTok, on YouTube, and you are watching the adjustments where they're yanking somebody's neck with a towel or huge cracks and pops, that is not what we're doing. With pediatric adjustments, it's very gentle. It's the pressure of testing a ripe tomato to allow the bones to go into the proper position smoothly, efficiently, and with nice ease. And there is no pain. A lot of times our kiddos are laying on mom or laying on dad as they get comfortable with us so that they can be in a relaxed state when they're receiving their adjustment. Let's pull up what her rescan is. We do rescans every 12 to 15 visits. You can see how clear and balanced her new thermal scan is. She has been getting sick less. So her mom shared that she's got the sniffles and then it goes away. It doesn't turn into a full-blown ear infection. It doesn't turn into a full-blown fever with an urgent care visit because the fever is so high. Her body is learning how to handle the viruses and the bacteria that she encounters. Now, this is very common. Now, we are surrounded by bacteria, we're surrounded by viruses, and we need to be able to manage that viral load. And when our body is imbalanced, it's not able to do that. So a little bit of bacteria and viruses can cause things to get way blown out of proportion. But when we can have a nervous system that's balanced, the immune system's balanced, and it's able to react in a calm way. This is amazing. Let's just look back and forth between both of these. This was her first scan. This was her scan a month later. And she's feeling so much better. We love hearing these stories. And we love seeing how it's directly impacting the nervous system. So stay tuned for next week when we go over another case study.